Hello my dear students and welcome to our second class on Pathological Anatomy department. The theme of second class is stromal vascular or extracellular or mesenchymal degenerations. This degeneration localized on histone's territory. What is histone? Histone is a part of microcirculatory channel with surrounding elements of connective tissue like basic substance, fibril structures, cells, and nerves fibril. Stromal vascular dystrophy development as a result of metabolic disruption in the connective tissue and are detected in stroma of organs and walls of blood vessels. Classification of this degeneration way are protein, fatty, and carbohydrate. You may know that protein degeneration may include mucoid swelling, fibrinoid swelling, hyalinosis, and amyloidosis. The first three types of protein degeneration are stages of connective tissue disruption. We start from protein stromal vascular degeneration and we'll start from mucoid swelling. Mucoid swelling is a superficial and resolvable disruption of connective tissue. The most important words in this definition is superficial and resolvable. Mucoid swelling characterized by the accumulation in the substance of the connective tissue of glycosaminoglycans, which leads to increase in vascular tissue permeability and release of finely dispersed plasma proteins, albumins. Mechanism of development mucoid swelling is infiltration. Mucoid swelling is more common in walls of arteries and arterioles, heart valves, parietal endocardium. We couldn't find any macroscopical reasons of this disease, but the most important changes are localized in microscopical level. The phenomenon of metachromasia is relieved, especially with toluidine blue. In the foci of mucoid swelling, we can see accumulation of glycosaminoglycans and changing toluidine blue to pink or red color in these areas. The phenomenon of metachromasia is changing of normally color of stain to another color. Like in this example, we can see changing from blue to pink or red. Mucoid swelling in electron microscopic level relieved extracted in fibrillary spaces containing granule proteins. The collagen fibrils are preserved only in some places, their distinction in relief. Mucoid swelling is a reversible process. However, it often turns into irreversible of deep disorganization of the connective tissue. It leads to fibrinoid swelling. So, fibrinoid swelling, it's second type of protein, stromal vascular proteinosis, dysproteinosis. The basis in the disruption of the main substances and connective tissue fibrils, accompanied by sharp increase in vascular permeability and the release of coarse plasma proteins. Primary fibrinogen followed by conversion to fibrin. The mechanism of development of this degeneration is infiltration and decomposition. By electron microscope level, in zone of fibrinoid changes, the structures of collagen fibrils and fibrins will be detected. The process is irreversible and ends off with fibrinoid necrosis, maybe hyalinosis or sclerosis. The most important thing in fibrinoid swelling is formation of fibrinoid It's special complexes substance which we can find in damaged tissue. Hyalinosis is an accumulation of homogeneous semi-transparent protein substance in the connective tissue. Hyaline compositive fibril protein, which contains the destruct components of connective tissue, plasma proteins, immunoglobulins, complements, and lipids. Etiology: factor of hyalinosis. It may be associated with plasmatic impregnation, fibrinoid swelling, and also sclerosis. Mechanism of hyaline generation is decomposition and infiltration, the structure of fibril structures, and the impregnation with fibrins, globulins, beta-lipoproteins, immune complex, and in our substances, and our molecules. Classification of hyalinosis. There are two main types of hyalinosis: is hyaline changes of vessel and hyaline changes of connective tissue. Both of them may be common and local. So, totally we have 4 types of amyloidosis. It will be local vessel, common vessel, and local hyaline changes of connective tissue, and common hyaline changes of connective tissue. So, let's talk about all of them. Hyalinosis of vessel or systemic type of hyalinosis. It may be localized in small arteries of kidney, brain, retina, pancreas, and in other organs with small vessels. Causes is hypertension and hypertensive conditions. Mechanism of development with process will be decomposition and infiltration. Macroscopically, we will find contraction of an organ. In microscopical level, arterioles looks like enlarged hyalinoid tubes with stenotic or completely blocked lumen. Outcome of this process unfavorable. It will lead to sclerosis and necrosis in organs. Hyalinosis of vessel, local form. Localization may be different. It may happen in spleen of all people, and it will be like a normally healthy situation. The spleen is an organ with blood deposition. So plasma impregnation of vessel may develops in normally condition. Microscopically, we couldn't find any changes. Microscopically, we can find similar to synthesis hyalinosis. In small areas of organ, we can find hyaline dots. Outcome favorable. It's not disease, it's normally process in our body. Before we continue, we should talk about type of vascular hyaline, or type of hyaline of vessels, which we could find in vessels. We can find 3 types of it. First one is simple hyaline. It's a result of plasmarrhea due to arterial hypertension, for example. Second type is lipohyaline, based on proteins contains lipoids and lipoproteins. Most often, you may find this type of hyaline in arteries with artery of patient with diabetes mellitus. And third type is compositive hyaline. Consists of the products of the structure vessel wall in case of immune conflict. Most often it may be associated with rheumatic disease or atherosclerosis. Hyalinosis of connective tissue, systemic or general type. It development in outcome of fibrinoid swelling. for example, in rheumatic disease. Macroscopically, we can find affected tissue as solid within semi-transparent masses. Microscopically, collagenous fibrils are losing fibrillity, become homogeneous. The cell undergo the atrophy. Outcome unfavorable. Hyaline masses do not resolve and leads to sclerosis. Local type of hyalinosis of connective tissue is development in scars and have special name like keloid scars, commissures, funds of chronic cancers, unpaired age. Macroscopically affected tissue are solid, viscid, semi-transparent. Microscopically, collagenous fibrils are losing fibrillity, becomes homogeneous, the cell undergoes to atrophy. Outcomes of this process for local hyalinosis can resolve by special methods of treatment. Improvements is cosmetic defects. In next slide, I will show you some patient with keloid scars. You may find it in your practice when you be surgeon or another doctor which will have contact with post-operative patients. So, and now we talk about amyloidosis. Amyloidosis characterized by degeneration in the stroma of organs and vessels wall of the compound fibril protein, amyloid, which is not observed in normal condition. Amyloid consists of F component and P component. P component is plasma glycoprotein, and F component is fibrils of intralactin, natural and acid glycosaminoglycans, lipoproteins, transferrins, and our additions. Fibrils are synthesized by macrophages, plasmatic cells, fibroblasts, myelogenic cells, and other cells, which have got a phagocytic activity. Classification is very difficult. There are many types of classification. According by biochemical structure of F component, it may be AA type, AL type, ASC1 type, and FAP type. In practice, you may hear that AA type have name like first primary amyloidosis, AL secondary amyloidosis, ASC1 is family amyloidosis. Third type is for older people and associated with big age of patient, and FAP type associated with its family or genetic type of amyloidosis. According to etiology, it may be idiopathic or primary. The cause of this process is unknown. Hydriatic, genetic, hydriatic edemopathy is defect of fibral protein synthesis. Secondary amyloidosis, derangement of immunologic hemostasis, chronic disease, collagenous tumors, and another reasons. Senile involves derangement of protein metabolism, and local or tumoral type. The nature is not clear, so we actually don't know a reason of this process. Depending on the primary injury of organ and systems, it may be cardiopathic, nephropathic, hepatopathic, and another types. According to prevalence, it may be generalized and local. In nowadays, we have some theories of development amyloidosis. The first one is immunologic, in which amyloid is a product of reaction immunoglobulins and some substances which are formed under some derangement in our organism. Cellular local genesis. Amyloid is product of the secretion of the reticular endothelial system cells. So amyloidosis is disease of mesenchyma. And mutation theory. Formation of the protein fibrils is connected with the gene mutation under influence of different factors. So, I already told that in our department we will often talk about special stain. So, special stain reaction for amyloidosis will be Virchow macroscopical reaction. Conga red, methylene blue, methyl violet, iodine green. From this reaction, the first one is the macroscopical reaction. You may find it in autopsy if you put Lugol solution and sulfuric acid on the organ. You will get green reaction. Conga red is a typical microscopical reaction for amyloid. In this picture, you can see amyloid with conga red reaction, and free reaction with metachromacy phenomenon. It's methylene blue, methyl violet, and iodine green. All of these solutions change their color to red or pink or violet. So blue became pink, violet become red, and green become pink. Morphogenesis of amyloidosis includes four stages. The first stage is pre-amyloid stage. This stage includes transformation of mesenchymal cells into amyloidoblast. The second stage is synthesis by amyloidoblast of fibril proteins, the main amyloid component, F component. First stage is aggregation of amyloid fibrils with formation of amyloid substances framework. And fourth stage is joining of amyloid fibrils with plasma glycoproteins and tissue chondroitin sulfate in generalization of amyloid compound glycoprotein. So, for our course, we should know how looks like amyloid in kidneys and amyloid in spleen. Firstly, we will talk about kidneys. In kidney, amyloid may be localized in glomeruli, basal membrane of capillaries, tube basal membranes, the walls of blood vessel. In this picture we couldn't see any damaged vessels, and in stroma of organ. Macroscopically, you can see that kidneys are enlarged, solid, and have white color with sebaceous signs on incision. The macroscopical name of this process is large waxy or large sebaceous kidneys. Microscopically, how I already told, Amyloid is deposited in the glomeruli, basal membranes of capillaries, mesangium, in the vessel walls, stroma, and the tube's basal membrane. The vessel with amyloidosis, you may find it in this area of this picture. Outcomes. It's unfavorable, irreversible process, so it development to nephrotic syndrome, and what you should to understand. If you find amyloidosis of kidney in your patient's body, it will lead to chronic renal failure. You couldn't help to him. You only may waste time and not more. Amyloidosis of the spleen. Amyloid is deposited in lymphoid follicles, which looks like semi-transparent granules on incision, and have name saga spleen. It is a first stage of amyloidosis of the spleen. And after it, you can see diffuse the pulp, diffuse development of the process to all pulp of spleen, and you can see waxy spleen, second stage. The picture of first stage, you can see that in red area of incision of spleen, you may find white dots. These white dots is a localization of the amyloid in the spleen. And in second stage, you may find that you couldn't find any different areas. All spleen is enlarged and have waxy structure. Extracellular fatty degeneration appear in a case of metabolism, derangement of neutral fats and cholesterol. Firstly, we will talk about derangement of the neutral fats. It may be local adiposity or obesity and local lymphomatosis. Adiposity classification may be primary idiopathic or secondary, which include alimentary, cerebral, endocrine, and hydrotic. Depending on mechanism of development, it may be alimentary, cerebral, endocrine, and hydrotic. Depending on external manifestation, the distinguished, it may be symmetrical type, uniform distribution of fats, upper type. You may find adiposity localization on face, neck, upper shoulders, and all. Medium type in the abdomen, in the front of apron, and lower type of adiposity. According to the size and quantity of adipocytes in adipocytes and the adiposity, it may be hypertrophic and hyperplastic variant of obesity. Hypertrophic type of obesity characterized by the number of adipocytes is not changed. Adipocytes are enlarged and contain several types more triglycerides, malignant, and have malignant course. You couldn't change weight of this patient. You couldn't help him to have less lipids in his organism. And hyperplastic variant of obesity, the number of adipocytes is increased. The function of adipocytes is not impaired, and which this type of adiposity have benign flow. For us, like medical students, and in our course, in our department, we will talk about heart in obesity. Heart in obesity develops with general obesity of any origin. Macroscopical picture. The size of the heart increase under the epicardium is determined by the accumulation of a large amount of fats. Fatty tissue grow into the stroma of the myocardium, cardiomyocyte atrophy, accompanied by the development of heart failure, possible rupture of the right ventricle, in which obesity is more pronounced. Macroscopical picture of heart. In this part of picture, you may see heart in obesity. In this part, you may see healthy, normal heart, and you may find that lipids localized in epicardium, and this condition more difficult for heart working, for his function, and leads to heart failure. Local fatty degeneration are associated with lipomatosis and locate adiposity. In our department, it's all that you should know about local fatty degeneration. Cholesterol metabolism derangement is a basis of atherosclerosis. About atherosclerosis we will talk in second semester, in spring. Accumulation of cholesterol in the tuna intima of arteries with the following growth of connective tissue, sclerosis, and formation lipoproteins for protein detritus artery. In this picture you may see some stages of this disease. So in first stage it's microscopical change. We couldn't find any macroscopical manifestation of this disease. In second stage we can see that decrease of lumen of blood vessel, and in last stages we could see blockation of the lumen of the artery. Cholesterol disruption of the fat metabolism, cholesterol and its esters in the walls of the aorta and large arteries underlines the atherosclerosis. Macroscopical picture. Yellow spots and streaks are visible in the aorta intima, as well as white-yellow plaques towering above the surface, some of them ulcerated. Microscopical picture. When staining by Sudan in intima of the aorta, lipid deposits in the form of droplets and needles of the cholesterol crystals colored in orange, and we can find them in these places. Fat inclusions are found in xanthine cells, macrophages, smooth muscle cells. Among the deposits of lipids, the foreground of the connective tissue. Extracellular carbohydrate degeneration may be connected with the balanced derangement of glycoproteins and glycosaminoglycans. So it's all information that you should know about carbohydrate degeneration. So theory of my class is end in this slide. What you should to do right now. On portal you may find cases for second class and test for second class. You should done it. After that you should draw one examination slide from today's class. Examination slide from today's class is kidneys in amyloidosis. And it's all. Thank you for your attention and goodbye.